This is the final section of the lecture for substance abuse, part 4. About 19% of adolescents in the United States say they've sniffed inhalants at least once in their lives. They are usually volatile solvents such as spray paint, glue, cigarette lighter fluid, and propellant gases used in aerosols. Inhalant use may be an early marker of substance abuse and should be the focus of increased preventive efforts and early diagnosis and treatment. Inhalation is the major route of ingestion for a number of common household and industrial volatile substances. Forms of use include sniffing, huffing, bagging, or spraying. Because inhalants are readily accessible, inexpensive, and produce a rapid high, they are more often used by pre-adolescents and adolescents. The four main classes of inhalants are volatile solvents, aerosols, anesthetic agents, and nitrites. They act as CNS depressants, but are also extremely damaging to the cardiovascular and respiratory systems. Users may develop peripheral neuropathies and exhibit tremors and weakness. Sudden death may occur from direct toxic effects, aspiration of gastric contents, trauma, and suffocation. No antidotes are available for these substances, and treatment of toxicity is symptomatic. Smoking cigarettes is the most damaging method of nicotine use. Cigarette smoke contains more than 4,000 chemicals and gases, including at least 45 cancer-causing or tumor-promoting agents, and a number of hydrocarbons or solvents. Nicotine passes freely into breast milk and may be toxic to the nursing infant. Push pause and watch the video, Nicotine's Effect on the Brain. Withdrawal symptoms may occur within the first few hours after stopping smoking, peak in 24 to 48 hours, and last from a few weeks to several months. After withdrawal subsides, cue-induced craving may cause smoking relapse. These are the side effects of nicotine. I'll let you read through those on your own time. And then finally, let's talk about nicotine replacement therapy. And I just want to put a plug in for respiratory therapy in most facilities, and I know for sure in the Medford Hospital. Respiratory therapy provides smoking cessation counseling, and they don't even charge for that because it's really important to them to try and get people away from smoking. So check into the resources at your own facility for that type of service that would be provided to your patients. So medications. Nicotine replacement therapy should not be used by pregnant or nursing women. Smoking while using it may cause nicotine overdose. Tapering of all agents except transdermal patches is required. Replacement agents used are usually a matter of personal preference. The stronger doses of agents should be used by heavy smokers. Using more than one agent at the same time should be discussed with the healthcare provider. And generic preparations are available for some of the agents. Medications include bupropion. It's an atypical antidepressant unrelated to nicotine that has been approved by the FDA for smoking cessation. The exact mechanism of action is unknown. It's thought to inhibit uptake of dopamine and to a lesser degree norepinephrine, and this reduces the urge to smoke and withdrawal symptoms. Bupropion may be combined with NRT to provide additional benefit, and NRT is nicotine replacement therapy. Bupropion is marked as Zyban for smoking cessation. It is available as Wellbutrin for use as an antidepressant. The other medication that can be used is Chantix. It's an alternative to nicotine replacement therapy and to bupropion. It is a nicotinic receptor partial agonist that reduces cravings for nicotine and decreases the pleasurable effects of cigarette and other tobacco products if tobacco is used. Treatment is 12 weeks, and those who successfully quit smoking during treatment may continue with an additional 12 weeks to increase the long-term cessation. And this should be started 1 week prior to quitting. So that's the end of our substance abuse lectures. I hope this has helped you learn some new insightful information.